most of the discussion today, I think, has been around protecting my rural neighbors and healthcare providers. And, as a resident of a rural community, representing a rural community and using rural healthcare, and I always read policies like this aimed at helping little old me, my family, my rural community, and I read it just a little more closely. And again, I'm going to be a no vote. I think highlighting social policy under the guise of protecting rural health care generally is not just misguided. There's going to be unintended consequences in less health care, less family practitioners for my children and me and my wife and my neighbors. There were amendments that I think that would take this policy out of the hands of the Puget Sound, those policymakers and Olympia, and put it in the hands of healthcare providers in the rural communities. Folks in the most vulnerable communities with the threat of potentially having a larger healthcare provider come in, buy out a smaller healthcare provider, and then not provide those services that really are a public good for many of us. And we had an opportunity to do that, and sadly we didn't. And this policy, I don't think actually protects those that it's intended to protect. So I'll be a no vote.